If you're trying to quit smoking, the Nicoderm CQ Patch can help by providing a steady dose of nicotine to help reduce withdrawal symptoms. When you stop smoking, your body craves nicotine, which can lead to symptoms like irritability, headaches, and difficulty concentrating. Using the Nicoderm CQ Patch as part of a comprehensive smoking cessation program can increase your chances of success. It's important to remember that quitting smoking is crucial for improving your health and reducing the risk of lung disease, cancer, and heart disease. Follow the recommended daily dosage and apply the patch at the best time for you to help manage your nicotine cravings. When using this medication, it's important to follow the directions on the product package if it's over the counter, or the patient information leaflet if it's prescribed by your doctor. Make sure to start using the patch on your quit day and apply it to a clean, dry, non-hairy area on your trunk or upper arm. Consult your doctor or pharmacist to determine the best brand and dosage for your needs. It's important to apply a new patch each day at the same time, gradually lowering your dose until you no longer need nicotine replacement. If you experience withdrawal symptoms or have trouble quitting smoking after 4 weeks, talk to your doctor. Some common side effects of using the Nicoderm CQ Patch may include mild itching, redness, burning, and stinging at the application site. If these symptoms persist for more than 4 days, it's important to consult your doctor. Other possible side effects may include nausea, dizziness, flushing, heartburn, or headache. It's also common to experience nicotine withdrawal symptoms such as dizziness, anxiety, depression, or trouble sleeping when you stop smoking. If these symptoms become severe or last for a prolonged period, it's important to seek medical advice. If you have been prescribed this medication, it's because your doctor has determined that the benefits outweigh the potential risks. It's important to note that many people using this medication do not experience serious side effects. However, serious side effects are more likely if you continue to smoke while using this product. If you experience any mental or mood changes, numbness or tingling in the hands or feet, or swelling in the hands, ankles, or feet, it's important to stop using the medication and consult your doctor immediately. In rare cases, a serious allergic reaction may occur. If you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's also important to report any other side effects to your doctor or pharmacist. As always, it's important to consult your doctor before starting or stopping any medication. If you experience any side effects, it's important to seek medical advice. It's important to talk to your doctor or pharmacist before using Nicoderm CQ Patch if you are allergic to nicotine or adhesive tape, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems. Before using Nicoderm CQ Patch, make sure to inform your doctor or pharmacist about your medical history, especially if you have any of the following conditions: blood vessel disease, diabetes, heart disease, high blood pressure, liver or kidney disease, esophagus problems, stomach/intestinal sores, certain adrenal problems, overactive thyroid, seizures, or skin problems. If you are going to have surgery or an MRI test, it's important to inform your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Strenuous exercise may affect how much nicotine is absorbed through the skin, so it's important to talk to your doctor about the effects of exercise while using this medication. Avoid exposing the skin under the patch to direct heat sources such as heating pads, electric blankets, heat lamps, saunas, hot tubs, heated water beds, or prolonged direct sunlight while wearing the patch, as heat sources may cause more drug to be released into your body, increasing the chance of side effects. If you are pregnant, it's important to try to stop smoking without using a nicotine replacement product if possible. During pregnancy, Nicoderm CQ Patch should be used only when clearly needed, so make sure to discuss the risks and benefits with your doctor. Additionally, nicotine from smoking and from this medication can pass into breast milk and could have undesirable effects on a nursing infant, so consult your doctor before breastfeeding. It's important to be aware that using the Nicoderm CQ Patch can potentially affect how other medications work in your body. This means it's crucial to keep a record of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your healthcare provider. Do not make any changes to your medication dosage without consulting your doctor. Quitting smoking can also impact how your body processes certain drugs, including acetaminophen, caffeine, insulin, oxazepam, pentazocine, propoxyphene, propranolol, theophylline, and tricyclic antidepressants. This also applies to water pills or diuretics such as furosemide. It's essential to inform all your healthcare providers that you are quitting smoking. If the Nicoderm CQ patch is chewed or swallowed, it can be harmful. If someone has overdosed, the patch should be removed if possible. For serious symptoms like passing out or having trouble breathing, it's important to call 911. Otherwise, it's important to call a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include confusion, drooling, seizure, slow/shallow breathing, and hearing problems. It's important to remember that if your doctor has prescribed the Nicoderm CQ patch for you, it's for your use only and should not be shared with others. This medication is intended for your specific needs and should not be used by anyone else. If you forget to change your patch on time, change it as soon as you remember. You can change your next patch 24 hours later or go back to your usual dosing schedule. Do not double the dose to catch up. When using Nicoderm CQ patch, it's important to store it in the original packaging at room temperature, away from light and moisture. Don't keep it in the bathroom. Keep the patches in the sealed protective pouch until you're ready to use them, and apply the patch immediately after removing it from the pouch. Don't use it if the pouch is damaged, cut, or opened ahead of time. And as always, keep all medications away from children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed, following the instructions in the How to Use section. Remember to always follow the proper disposal guidelines to ensure the safety of others and the environment. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.